The traditional IVF procedure kind of goes as follows. A patient comes in and goes through what we call controlled ovarian hyperstimulation. So we stimulate their ovaries to create an abundance of eggs, but within reason. At the end of that process, we then go ahead and we retrieve or we collect those eggs by something we call an ultrasound-guided follicular aspiration. So it's an in-office minor surgical procedure that we do here in our clinic. Everything we do here is self-contained. So they go to sleep, and it takes only about 15 minutes once they're asleep for me to take a needle and through ultrasound guidance poke it through their vaginal wall into the ovary to aspirate the fluid from the follicles and collect the eggs. They then go into the laboratory and we combine those with their partner's sperm. If the sperm are fantastic, we just put the sperm in a dish with the eggs and they fertilize the eggs on their own. We call that co-incubation. If the sperm aren't perfect, we can actually take an individual sperm and put it inside each egg. We call that intracytoplasmic sperm injection. When the embryos form, we allow them to grow, and ultimately we determine how many embryos we're going to then take and put back in the woman's uterus based upon her age and based upon the quality of the embryos. And we're trying to find the right number of embryos to maximize the chance of pregnancy but diminish the risk of too many babies. We'd like people to have ideally one baby at a time. Once we pick the number of embryos, we do the embryo transfer by just simply placing a small little catheter through the cervix and put the embryos into the uterus. It feels like having a pap smear done. Once the transfer is done, the patient stays with us for a little bit of time and then goes home and rests for the day of and the day after transfer. There's a variety of patients that are candidates for IVF, and number one are patients with male factors. So if the partner has sort of diminished sperm numbers. The other sort of more classic candidates for IVF are patients that have had tubal damage from prior infections or surgeries, or a lot of scar tissue in their pelvis from prior infections or surgeries. There's also patients who have been trying lesser aggressive treatments like ovarian stimulation in combination with intrauterine insemination. And if they haven't been successful for 3 times, I'll be telling them, you know, you need to be thinking of moving to something like IVF. So some people want to know how ICSI is used in IVF, and everything we do seems to have an acronym. So it stands for intracytoplasmic sperm injection. So we can take one sperm and put it right into the cytoplasm of the egg where it has to be in order to initiate fertilization. Blastocysts are the most advanced stage of embryo development. That's the stage at which the embryo actually enters into the uterus to find a place to attach. And it's about the 5th day of embryo development. And the benefit of having blastocysts is it's the best timed embryo to be placed into the uterus for this receptivity with the uterine environment. The problem is embryos in the IVF laboratory tend to do better for the first 3 days of growth than they do for those last 2 days. So if the patients have a nice number of embryos and they're of good quality, then I think we have the luxury of letting them go to the blastocyst stage. If a patient only has a few embryos, then I don't think it's worth letting them go to blastocyst, because all we're going to do is potentially diminish their capacity for achieving a pregnancy. When we talk about success rates for IVF, it really depends primarily on the age of the woman who's participating in the cycle. And to put it in some context too, couples that have no fertility issues at all, that are trying to conceive per month, have about a 20% chance per month of conceiving. With IVF, if a patient's under 35, she has about a 60% chance of conceiving with IVF. If the woman is 35 to 38, about a 50% chance, 38 to 40, 41 and above drops down to about a 20% chance. So really, the chance for success of IVF is very dependent upon female age.